What is stroke? The term refers to something happening suddenly. So think of it as like a blow or a strike to the head. And the stroke here is a blow which brings on symptoms very quickly, like the droop face, slurred speech, confusion. So sudden change, like a blow to the head. "15 million people suffer a stroke every year. Of them, 5 million die and 5 million continue on disabled." That's quite a lot of people. Strokes occur in people over 65. It can present in people much younger. So what is a stroke exactly? It's basically when the blood that carries oxygen to the brain is cut off. So when the brain cells are cut off from oxygen, they become damaged. And the parts of the body that are controlled by that part of the brain that's damaged starts to develop symptoms, signs and symptoms, which is called a stroke. And so if the brain is injured, the injuries and the signs and symptoms can be wide-ranging. So for example, if a part of your brain that controls your memory is affected, then you get memory loss. If the part of your brain that controls your muscles, the movement of the body is affected. If it's a part of the brain that gives you feeling and sensation, then you have the feeling of numbness or just that loss of feeling. So the range of stroke and how it can present can be quite wide-ranging. So as soon as you see some of the signs and symptoms of stroke, it's really important that you act quickly. The sooner that you recognize the signs and symptoms, the better the chance somebody can recover from a stroke. So if you suspect anyone around you of suffering a stroke, even a mild one, you need to act fast. FAST, the acronym, stands for face, is the face drooping. A stands for arms, is their difficulty in trying to raise the arm. S is for speech, is the speech coming out slurred or just strange. And T is for time. It's time to call for help. So FAST is something that you can easily remember, and that can help you catch some signs and symptoms of a stroke. Once help has arrived and you're whizzed off with the ambulance, you'll be screened by the doctors and put through some scans to determine which part of the brain has been affected. Now, with those scans, they will determine what type of stroke that you've suffered. Either number one, it's an ischemic stroke, which is a blockage of the blood vessel, or it could be a hemorrhagic, so there's a bleed, and that's the second type of the stroke. It's very important to determine what type of stroke that you suffered, because the majority is the ischemic type of stroke, so there's a blockage. And a blockage usually occurs when there's a build-up of plaque or thrombus within the lining of the vessel wall, and then over time that blockage tends to block the blood flow and gives you problems. So if the clotting type of stroke has been identified, then the saving medication prescribed by the doctor will break down the fatty tissue which is blocking the vessel, and so the blood flow and the oxygen can get to the brain and provide life-saving treatment. That medication, the way that it works is called thrombolysis. Breaks up the thrombus, the clot, so that the blood can flow happily. Sometimes stroke symptoms like the drooping face, loss of your arm, the power to move your arm, and other signs and symptoms of stroke can disappear within 24 hours. This is known as a transient ischemic attack. You must be very careful with those TIAs because they present just like a stroke, but they disappear, so people often ignore that they had strange signs. It is really important that you seek medical attention because that is still an issue that you need to resolve. The TIA acts as like an alarm bell, so it just warns you that there's a full-blown stroke that may be ahead if you don't fix up the problems within the clotting or the bleeding within the blood vessels. If you've discovered to have suffered a stroke, you may need a lot of close medical attention and medications to assist with stabilizing the clotting situation or the bleeding situation, and your body can adapt and recover with close medical supervision. So make sure that you do flag any signs. So remember FAST, the acronym, seek urgent medical attention and follow those instructions to help optimal recovery. In managing your stroke symptoms, to partner with the medical attention that you're receiving, there's a whole team of allied health professionals that can help you with your recovery. So if you're having speech problems, there's a speech therapist that can assist you. If you're having problems with eating, there could be a dietitian that can assist you with that. With movement and your home setup, there's physiotherapy and occupational therapy, and we're all a part of the team to help get you moving if you've suffered a stroke. Okay, so here are the main do's and don'ts in avoiding suffering a stroke. Number 1, avoid high blood pressure. Number 2, quit smoking. 3, lower your cholesterol. 4, be more active and exercise. Number 5, make good eating habits. Number 6, monitor your alcohol intake. And number 7, do keep a close eye on your blood panel. If you're diabetic, try and make sure those numbers are friendly. And if you are diabetic, I think it's good practice to just keep an eye on what your blood work is telling you. It's the summary of what stroke is, how it's caused, how you can prevent it, and if you have suffered a stroke, how you can treat it and the help that you can seek in rehabilitating your body and returning to optimal performance. So with physiotherapy, we can help with getting you moving and also giving you a lot of great advice around your lifestyle and some of the choices that you make, particularly with nutrition, and assisting you with understanding your blood work so that we can help along with other team members in getting you moving. Making healthy simple. Have a great day.